I would like to take you through the agenda for today. Welcome address will be delivered by Rotarian Aroshi Virakon, President of Rotary Club of Colombo. Dr. Janaki Vidana Patirana, Director National Cancer Control Program, will not be able to be with us due to an unavoidable commitment. In her replacement, Dr. Saddharma Virakon will be taking us through the introduction. Our keynote speaker, Professor Aloka Patirana, will be enlightening us on breast cancer screening and early detection, followed by a testimonial video by Ms. Danya. Our third speaker will be Rotarian Nirmali Samarathanga, who will be explaining to us the cancer prevention and early detection services taken up by the Rotary Club of Colombo. Our fourth speaker will be Dr. Kanchana Vijayasinghe, consultant surgeon, who will be sharing with us the current management of breast cancer. This program will be live streaming on Lanka Hospital's official Facebook page and YouTube channel. There will be a question and answer session at the end of the whole webinar. And we encourage all our participants to feel free to inbox any queries that you have. And we will direct it to the lecture panel and give you the reply. To begin the program, I would like to cordially invite Rotarian Aroshi Nanayakara, President of the Rotary Club of Colombo, to deliver the welcome address. Over to you, Rotarian Aroshi.
Good afternoon, everybody. It's my pleasure from the Rotary Club of Colombo to invite you to this live webinar to commemorate the World Cancer Awareness Month. The Rotary Club of Colombo has been involved in cancer prevention and alleviation for over 2 decades now. We have a early cancer detection center run in Narahempita. We've been doing that for over 17 years now. And it's completely free of charge for any lady who wants to come and get tested. Our newest initiative, together with the Ministry of Health, is elimination of cervical cancer. We have already donated high-end machinery in testing cervical cancer. And we are just going into a training program for midwives as well as health professionals who are taking the message to the community at large within Sri Lanka. Cancer and cancer prevention is something that is at the core of the Rotary Club of Colombo's community service. And we are very happy to be here with you today. I'm not going to take too much time. There are eminent speakers, experienced and highly skilled professionals here who will be imparting knowledge, as well as encouraging all of our audience to get the necessary testing done in time so that prevention is possible. From our side, we would like to say thank you to the Lanka Hospital, who is partnering us on this project, and we wish everybody a successful seminar. Thank you.
Thank you, Rotarian Aroshi Nanayakara, for that warm welcome. We will now move on to the introduction of breast cancer. Our resource person is Dr. Saddharma Virakon, Registrar Community Medicine, National Cancer Control Program of Sri Lanka. Over to you, Dr. Saddharma Virakon.
Yeah, and on behalf of National Cancer Control Program, I would like to thank the organizers for inviting us for this important webinar in Breast Cancer Month. So in my presentation, I will basically focus on the current situation of breast cancer in Sri Lanka with a brief introduction to breast cancer. So as you can see in the global map, most of the countries in the world are highlighted in pink color, which means the most common cancer is the breast cancer among females globally. It is the same in Sri Lanka. You can see breast cancer accounts for 26% from all cancers among females in Sri Lanka. So breast cancer is one of the most important topics that we should talk about. In 2019, we have diagnosed almost 4,500 new cancer patients in our country, which means on daily basis we diagnose around 12 cancer patients daily, which means today we are going to diagnose another new 12 breast cancer patients. If you talk about breast cancer, one would think that it's all about females, but it's not. In 2019, we have diagnosed more than 100 breast cancer patients who are males. So males also has to be vigilant, but we know that females have much higher risk than the males. This is the trend, the current trend of breast cancer in Sri Lanka, which is an increasing trend, and it is very significant. You can see in 2005, there are only 18 breast cancer patients for 100,000 population, but it has increased up to 33 in 2019. So this is very remarkable. I mean, this is very significant increasing. We have analyzed and we have noticed that this trend is one of the highest trend in the world. So we have to be vigilant. So this is the graph that it shows the age distribution. You can see the peak is around 70 years, but we should please note that this is only the age at diagnosis, not the incidence. So that means that we diagnose most of the patients in latter part of our life, which may indicate that we are diagnosing patients in late stages. So we have to think about this. Risk factors for breast cancer, I think in next presentations this will be discussed in detail, but I will summarize. Some risk factors we can change, some we can't. Factors like age, sex, genetic factors like those things we can't change, but we can change our lifestyle like obesity, physical activity, diet, tobacco, alcohol. Those things are risk factors, but we can change them. So I believe this may be the most important slide that I want to highlight. You can see I have compared 4 countries. 2 of them are the Europe countries. You can see the incidence in blue bar. The incidence of breast cancer is much more higher than our countries in USA and Australia. That's a good way, but focus on the red bar. It's almost same in all countries. But this means when they diagnose 90 patients for 100,000, only 12 people die. But when we diagnose around 30 patients, out of them around 12 patients is going to die, which means in developed countries they are diagnosing these patients. It may be the reason in early stages. Still we are when we talk about our clinicians also, they also mentioned still we are diagnosing our cancer patients, especially breast cancer patients in late stages. So this is very important fact. So ASR, that is the incidence of breast cancer, still low in our country, but annual percentage increase, which is the increasing trend, is one of the highest. That means we are reaching in a very high speed. So if we do not take any action right now, we will be in trouble in upcoming future. Definitely there will be high mortality rate due to breast cancer. So how can we prevent this? Breast cancer prevention is a possibility. I have mentioned that there are some risk factors we can control, but that is, we can't prevent every breast cancer. Therefore, early detection is very important in breast cancer. So which will be discussed in detail in next presentation. As the Ministry of Health, National Cancer Control Program has taken initiative to improve or distribute these services, the breast cancer early detection services in the country. At the moment, one initiative is the Cancer Early Detection Center. One is Narahangita, it's the partnership of Rotary Club, and Jaffna we have developed a new detection center, and in near future we'll be able to open new 3 centers in Matara, Ratnapura, and Kurunegala. Our aim is to have at least 1 center in each province, because we have noticed that in our Narahangita center we have very good successful stories. On the other hand, we are planning to establish a dedicated breast clinic in main hospitals in the country. We have started several in different hospitals. In these clinics, the clients can come directly to the specialist, and they can ask for help for their breast problem. On the other hand, mammography is one of the key technology that we are using for diagnosis and screening for breast cancer. So during the past few years, we have been able to distribute these facilities all over the country, but we know that still there are underserved areas. So in upcoming years, our main focus is to provide the facilities for those areas and increase the usability, I mean the utility of these machines if there is any underutilized machine. So ultimately, what I want to highlight is whether we like it or not, anyone can get a breast cancer at any point, but no one should be diagnosed at late stages. That's the truth. So thank you very much for again inviting us for this webinar, and we like to invite on behalf of NCCT, we would like to invite all the participants in public sector, private sector, and NGOs to be get the partnership with us and join with us to fight against breast cancer. Thank you.
Thank you, Dr. Sadharma, for that detailed presentation given to us on prevalence and proving the importance of creating awareness about breast cancer. Our next resource person is our guest speaker, Professor Aloka Patirana. Professor Aloka is a senior consultant surgeon at Colombo South Teaching Hospital, professor of surgery and dean of the Faculty of Medical Sciences of University of Sri Jayewardenepura. He is also visiting consultant at Lanka Hospitals PLC. Sir will be enlightening us on early detection and screening of breast cancer. Over to you, sir.
And I would like to take you all through how early detection in breast cancer helps to reduce the problems associated with it. So as you all heard earlier, it's commonest cancer in women, and it is said that 1 in 8 women in the USA would get breast cancer during their lifetime. And as Dr. Sadhar mentioned, it's not as common in our country. We are about 1/3 less than the West, but the incidence, as you have heard, is noted to be increasing in Sri Lanka, particularly for women before menopause. So even this diagram you follow, overall breast cancer is increasing, particularly the males, and the rate of increase has been high in the recent past. So breast cancer starts as an abnormal growth in the breast ducts or the tubes. So if you look at the diagram, the breast is composed of several glands, and they are connected through a tube to the nipple where the milk secretion comes out. So in this, you can see the tube or the breast duct, which is lined by a single layer of cells. And these are the cells which actually turn malignant. So if you notice here, the lowermost picture shows the normal duct or the normal tube. And when a cancer starts, the single layer of cells starts to divide, and the blue color cells indicate the cancerous growth. So for some time, when it starts, it is limited to the tube. It does not penetrate through. So at this stage, we call it a stage 0 cancer, where the cancerous cells are within the duct. They have not grown outside, so it is the earliest stage of breast cancer. But after a few years, usually it takes a few years for this process to progress, it breaks through the lining of the breast tube, and that is the first time it starts to invade the body tissues. That is stage 1 breast cancer, the smallest stage. But remember, from stage 0 to stage 1, it takes a few years to progress. So then it spreads across the lining of the tube. Then the next stage is it invades the lymphatics or the lymph channels of the breast and spreads to the armpit or the glands in the armpit, which we call the lymph nodes of the armpit or the axilla. So you can see the green colored nodes in the armpit, which is the next step where the cancer spreads. So by this time, it has progressed from stage 1 to stage 2 or 3. What happens? So once it has grown out of the ducts, whether it goes to the lymph nodes or not, it can spread to any part of the body, but usually the lymph nodes are involved before the cancer spreads to other regions of the body. So other regions could be the brain, the lung, the liver, or the bone. Those are the common cells. So if it has spread beyond the breast or the armpit, we call it stage 4. So that those are the stages. Stage 0 is when the cancer is within the duct. Stage 1 is as the earliest phase where it goes out of the duct or the tube. Then stage 2 and 3 when it reaches the armpit, the nodes in the armpit, and stage 4 when it has gone to the rest of the body. So these are the 4 stages. So early detection means detecting the cancer at a very early stage, and if it is detected early, it has many benefits. Treatment, as you can understand, when it is limited to the breast tube or the breast, is limited. But if it has gone to the glands, the armpit glands, then it has to involve those glands as well in the treatment. And if it has gone to the body, you can imagine it means the entire body has to be treated for the cancer. So earlier you detect, the treatment is less complicated. And similarly, the outcome is also better. So it has been found out that the risk of reducing the early detection reduces the risk of dying from breast cancer by about 40%. You see this picture, it gives the percentages of survival based on the stage of breast cancer. So stage 0 is about 100% survival. So if you can detect the cancer at this stage, that person would not die from breast cancer. So stage 1 and 2, stage 1 is also not bad. There's about 98% survival rate. But as the stage increases, the survival falls. So in stage 2, it's about 88%. And you can see in stage 4, the survival is not very good at all. So it's about 16%. So if you detect early, the chance of you surviving the cancer is great. So that's what you must understand. So early is better. So how do we detect early? So if you see this, shows the size of the lung and how we can feel it. So to feel a lung in the breast, in an average size breast, it has to be about 1.5 inches or almost 3 centimeters or a little more than that for it to be felt. So by the time the cancer is 3 centimeters in diameter, it is invariably outside the breast tube. So it is not stage 0 or 1, it is very likely stage 2. So, but if you detect with X-rays, like using a mammogram, specialized X-rays, you could detect these cancers at a much smaller size. So at 0.5 inch or 0.75 inches, you could detect lumps with mammography. But if you wait for it to be felt or palpable, then the stage is either 2 or more. So that is why it's important to, if you want to survive the cancer, that is survival is 100%, it has to be detected at a stage before it is felt to a normal by examination. So mammogram is ideal method, therefore, to detect early breast cancer. It has helped to reduce breast cancer deaths by more than 30% in the West, where it is routinely performed in females after the age of 40 years. So there are some issues. People don't like to go for the mammogram. Now, if you see the picture earlier, the breast is compressed against two sheets, and it is not a very comfortable process. So because of that, some people don't like to go for mammograms. And also the issue with radiation, because people think that mammogram is an X-ray method, so radiation, that it can cause cancer. But actually, the radiation is too small to cause any concern. So even if you have annual mammograms, there is no increased risk of getting a cancer due to the regular mammograms that you are having. And even if you consider the pain, it's supposed to be less with the new digital mammographies. So that's what you need to know about mammography. So therefore, there are no serious side effects if it is done at recommended intervals. But there are the issues are anxiety. Now, when you do a mammogram, you might think, okay, what is it going to find? Would I have a cancer? So that it causes a lot of anxiety, particularly if there are false positives. So mammogram might pick up that there is a lesion, and it needs to be investigated to confirm whether the lesion or what you see in the mammogram is cancerous or not. So that takes time. So from the time of detection with the mammogram and up to the time of confirmation, there can be delay of a few days or a few weeks. So during that time, the patient has a lot of anxiety. So that is also a cause for concern, particularly in the West, where people do not want to wait. Now, setup, it's not that we are used to delays, but that delay, that period causes a lot of anxiety to people. So that is one issue with mammograms. So when should we start doing mammograms? So starting age in the USA, they recommend for women to start mammography by the age of 40 years. But in the UK, with cost concerns, they start at 50. But it is said that more lives are saved if it is started at an earlier age, so maybe 40. But in our country, because of cost concerns and lack of availability, you would have seen that every province, also every hospital does not have mammography. We would recommend for people who are at least concerned, at least once in 2 years if they can. Because in USA, they recommend it to be done annually, but in the UK, it's done every 3 years. So if we can do it every 2 years, I think that would be good. So if you look at the previous picture again, so mammography will pick up cancers in stage 0 and 1, where the survival, you can see, is 100% or 98%. So which means that if you get the cancer with the mammogram, you are unlikely to die from breast cancer. But if you think of the other stages, 2, 3, and 4, 2 where the lump is palpable, the 2 is better than 3 and 4, where 4 means it has spread to the rest of the body. So 2, the survival is 88%, but if you go to stage 4, it is 16%. So even if you can't diagnose with mammogram, it is better to feel it at stage 2 when compared to stages 3 and 4. So how do we do that? So one method that is recommended is self-breast awareness. It has to be started from the age of 25 years and it has to continue till 40 years at least when you start doing your mammograms. So what you should do is you should feel the breast, you should look at it, the mirror, and check maybe with the medical officer or regular checkups, maybe one every year or every 2 years, just to make sure that your breasts are normal. So when to check on your own is the recommended interval is every month, and ideally wait for about a week after the first day of your menstruation so that the breast is not dense and not very painful. So wait for a week after starting the periods, and it should be done every month. So clinical encounter or meeting a doctor is recommended every 1 to 3 years. So what should you look for when you're examining? So the commonest thing or most common thing that people would feel or should feel is a lump in the breast or under the arm. But there are other things that you can look for. That is unusual pain or redness in the skin or change in the breast shape or swelling or redness or a nipple discharge. Usually a blood-stained nipple discharge, not a clear watery discharge, but a blood-stained nipple discharge or a discolored discharge. So those are the things that you should look for. And if you detect any, then you should ideally see a doctor. But remember, most lumps that you feel are not cancers, because the common ones like the cysts, which are fluid-filled bubbles, or fibroadenomas, which are common in the young females from the age of about 12 up to about 25, those are not cancerous and they don't become cancer either. And most of the time, women feel just the normal thickened breast tissue. So therefore, you should not worry just because you feel a lump in the breast, because most of these lumps are unlikely to be cancers. But any lump which does not disappear after menstruation should be evaluated, and you should seek medical advice if you feel a discrete lump in the breast. So there are people who are at high risk. So those are people who with genetic abnormalities. Now remember, genetically determined breast cancers are not very common. Commonest cancers are, it's commoner to find people with no genetic risk having breast cancer. So, but rarely we do find genetic abnormalities contributing to breast cancer. That's one high risk group. And the other high risk group, which we rarely see, are the people who have had radiotherapy to the chest between the ages of 10 and 30 years of age. So that rare small group would need to start screening at an earlier age, and will have to have more frequent follow-up along with other strategies, and they will have to have specialist advice. Then there's a group of people who are at moderate risk. Now that is having one close relative or first degree relative with breast cancer, but it is not recommended for those people with the moderate risk to have any special screening. So they can still follow the same screening that I mentioned, that is your self-breast examination starting at the age of 25 years, going up to 40, and then starting mammography from the age of 40, either annually or biannually. So in summary, breast cancer, you heard that it's the commonest cancer in females, and early detection is beneficial for two reasons. The treatment is less invasive, and you have a very high chance of survival. You find it in stage 0 or 1, 100% survival, whereas in stage 4, it's about 20% survival. Mammography is the only proven screening method to detect stage 1 or 0 cancer. So starting age ranges from 40 to 50 years for mammography. And for all women, self-breast awareness is important to at least detect the cancer at stage 2. And it should start at the age of 25 years and once a month after having your menstruation. So touch, look, and check. And most, remember, once again, I want to reiterate that most palpable lumps are not cancerous. Thank you.
Thank you for that excellent presentation, emphasizing the physiology, the screening, and the importance of early detection, and also sharing us the evidence of early detection gives a better outcome. Now let's Ms. Danya, who had successfully recovered from breast cancer and is willing to share her experience with us today. Ms. Danya, over to you. While we are trying to connect Ms. Danya, we will move on to the next segment. Our next speaker is Rotarian Nirmali Samarathanga, Chair of Cancer Prevention and Early Detection Center, past President of Rotary Club of Colombo, who will be explaining to us the cancer prevention and early detection services by the Rotary Club of Colombo. Over to you, Rotarian Nirmali Samarathanga.
Good afternoon, everyone. So I chair the Cancer Prevention and Early Detection Project of the Rotary Club of Colombo. It's a great privilege to be among such eminent speakers. Thank you to Lanka Hospitals for organizing this event in partnership with Rotary. My role is essentially to share with you Rotary's contribution towards fighting cancer through this project, and with particular emphasis on breast cancer. And I'll start with a brief video on the center itself. So just give me a minute. Let me just move on to the next slide. Okay, so moving on. So what motivated us 17 years ago to launch this project? It was when we learned that there were around 15 to 20,000 new cases every year, and many of them did not survive. And the high mortality and morbidity was basically due to late presentation in stages 3 and 4. I think Professor Aloka talked of the stage 1 and 2, which is where one can do something about it. But as you get on to later stages, it becomes more difficult to address the disease. But what was most significant, which we learned, was that 30 to 40% of cases were actually preventable with education and awareness building. And more than that, that 1/3 were curable with screening, early detection, and timely follow-up treatment. For us, this meant that we could potentially save several thousand lives, which would otherwise be lost to cancer every year. So we launched this project, and the key features were it's a partnership between Rotary Club of Colombo and the National Cancer Control Program of the Ministry of Health. And if you look at the main features, this is the only central standalone national facility dedicated for screening and early detection. It's basically a walk-in clinic, and it's accessible to the general public. And we focus particularly on the low-income groups. It offers a comprehensive service, screening and early detection, which includes consultation, diagnosis, lab investigations, as well as prevention activities through health education and public awareness building. So essentially, Rotary provides the building and the equipment, as well as supporting public awareness building activities, and the National Cancer Control Program are responsible for all the operations of the center through their team of doctors and nurses. And as our President Aroshi mentioned at the start, all these services are entirely free of charge. We have here a small picture of the historic signing of the Memorandum of Understanding 17 years ago with the Ministry of Health. We chose to initially focus on breast cancer. I think there's nothing to argue there, because we've seen the previous speakers and we know the position on breast cancer. It's the most common cancer amongst women in Sri Lanka, and accounts for over 25% of cancers in females. And in fact, we now find the significant number diagnosed at a fairly young age of around 50. It's the highest incidence of all cancers, and now more than 4,500 new cases are diagnosed every year. There's been an alarming increase of breast cancer in the last 10 years. And I can recall the time it was around 3,000 to 3,500 cases a year. So one can see the rate at which the incidence of breast cancer is increasing. It's in fact the leading cause of death amongst women in Sri Lanka in the 40 to 55-year age group. And what is more significant is that if these people had gone through early detection, through screening with timely follow-up treatment, it would have significantly reduced these deaths from breast cancer. We realized that it was essential that we had mammography as well as ultrasound scanning equipment if we were to be able to detect and effectively diagnose and treat these cases. In fact, we learned that a mammogram can detect cancer up to 2 years before it is large enough to be felt, and if detected early, can be cured. So 10 years ago, in fact, we equipped the center with a mammography machine, ultrasound scanner, digital film processor through our major donor, the Rotary Club of Birmingham, Alabama in the US. In fact, now we are looking at replacing some of this equipment, because after 10 years, obviously we needed to upgrade, and there is a need for replacing. So we are in fact looking out for donors to keep this operation going on the mammography machine in the future as we move on. We have a radiographer and radiologist assigned to the center. Our focus is on the target high-risk groups, or where early symptoms are present and need to be confirmed. And significant is that of the women screened up to date, approximately on average, 15 to 20% have been detected with abnormalities requiring further investigation. So you have here our donors from the US who handed over the machine, and the machine actually, which is in operation and doing regular breast cancer screening. So the center itself, if you look at very briefly, for those who want to know more about the center, it's down Elvitikala Mawatha, and it's known commonly as a Nara and Bitter Clinic. It's open from 8:30 to 3:30, and it's operated by the Cancer Control Program. As I mentioned, the services are free of charge. It's in a very centrally located facility, so it's easily accessible by public transport. One thing we were very particular about is that to create an ambience that ameliorates the stress of screening, because we found that this was one of the reasons why people stayed away from Maharagama, from the cancer hospital for screening, because of the stigma as well as the morbidity of going into that hospital, because we are looking at basically asymptomatic patients or apparently healthy people who need to be screened. So we had to encourage them to come to a place which would be more welcoming to them, and where it would not give them any fears. So this is the reason why we set up this dedicated center. It's manned by a team of doctors and nurses from the Cancer Control Program, who we owe a huge debt of gratitude for their commitment and their dedication to this operation. In fact, we've also in the past trained some of these teams. We sent a multidisciplinary team to the US, to the sponsored through our partners, to the University of Alabama in Birmingham Comprehensive Cancer Center for knowledge sharing and basically to exchange information. So we've been also supporting the center on that aspect as well. So the center focuses primarily on breast, cervical, and oral cancer, although they obviously would be handling all types of cancer. There is a focus here being cancers which are preventable and curable. We have a health education unit as well, because awareness building, we know, is a very critical part of fighting breast cancer. So there is a unit that handles the public awareness building and the various activities, as well as a mobile unit, which enables us to reach people who are unable to come to the center for screening. This operates around the country, as well as goes to workplace locations in Colombo and around to carry out screening camps. So yeah, coming to the services in a little more detail, basically, if one was to sort of want to know what goes on at the clinic, so they would have the relevant clinical history taking. You have for breast cancer screening, the physical and clinical breast examination where relevant, and the ultrasound scanning of breast is, if necessary. Similarly with mammography, it would be based on the doctor's decision if necessary. We also, for cervical cancer screening, have the Pap test and the HPV DNA testing facility. And for oral cancer, we do the examination of the oral cavity. And in all these cases, the next step would be to refer it to further management to the treatment center if required. Another aspect is that there is counseling, a counseling service and health education. And for example, I've highlighted this aspect of self-breast examination, which Professor Aloka also mentioned, which I would like to also re-emphasize the criticality of self-breast examination, which is essentially, I believe in the algorithm, this is the first step that one needs to embark on before we go into ultrasound and mammography, that the need for a female to carry out this self-breast examination once a month and from the age of 20, 25, around there, which would then enable them to keep a track and maybe identify something which is suspicious and which needs to be shown to a doctor. So self-breast examination is something that you are shown how to do at the clinic, and which would help females thereafter to carry out this on their own. Similarly, for males, we have a particular process we go through for the cancer screening. We have here some pictures of our HPV DNA testing facility, and of course the other, to give you an idea of the clinic itself. As I mentioned, another critical aspect of fighting cancer is the prevention aspect, which is through awareness building. And here we have been carrying out programs. We have in October Breast Cancer Awareness Week, where we have extended sessions of screening and providing information, educational videos, and basically it's being a walk-in. People have the access to just go and find out and get information, which will put their fears at rest also, and also educate themselves about the criticality of screening and early detection, as well as the availability of the services, which is very important for people to know where they could go to for these various services. Rotary has also published a very useful booklet called The Road to Cancer Prevention. In all 3 languages, we've published several thousand of these, and it's been distributed island-wide through our network of Rotary clubs. And this tackles the various cancers, and specifically on the breast cancer, we go into great detail on how to do a self-breast examination. We talk about the symptoms and signs to look out for. So this book is also available at the center as well as around well-woman clinics around the country. Also on awareness building, we have a regular presence in the media who have been very supportive on this project, and we go into all 3 languages there again in the media, highlighting the services offered by the clinic, as well as encouraging people to come and get themselves screened to prevent this being diagnosed at a later stage. We also found that it was necessary for us to move, also have this service offered out of Colombo, because we were having so many who were coming from far-flung areas like, say, Kurunagala, Ampare, down south, Anuradhapura, and so it was necessary for us to start looking at regional early detection units. The National Cancer Control Program now has it in their plan, and I think the representative, Dr. Veerakun, I think from the Cancer Control Program, talked of the setting up of centers island-wide. So we have already gone ahead with the first center in the breast cancer early detection unit in Kurunagala. That was in 2016. And here we are handing over a mammography machine and digital processor to the Kurunagala Hospital for the newly set up breast cancer screening unit. So we would be working with National Cancer Control Program moving forward and looking at some of the other areas where they would be seeking to set up such similar early detection units. Okay, so the results of our efforts, basically, we have screened up to now through this project over 78,000, mainly females. And of that, we have identified over 22,000 cases showing abnormalities which require further investigation. These are cases which potentially could have developed full-blown cancer and had a different ending. And these are ones that we look at as potentially having been saved. So this is really what has motivated us to keep going with this project and to look at expanding it and moving forward. So this slide is one of the final ones, just on the information slide on the center. And because of the COVID-19, the National Cancer Control Program has introduced health and safety regulations, which the patients or those visiting the center have to adhere to. So this is just an information slide. And I would like to end finally with this slogan, which is what was globally used last year for Breast Cancer Awareness Month, which is Together We Can. And this is to highlight that each of us needs to spread this message of screening and early detection, which can save lives, and also the importance of partnerships. We now have this today partnering Lanka hospitals, and we have on this project this very valuable partnership, which is the secret, I think, of the sustainability and success of this project, our partnership with the National Cancer Control Program of the Ministry of Health. So let me end there, and thank you so much for your attention. Thank you.
Thank you, Rotarian Nirmali Samarathanga, for the detailed explanation given to us. We applaud for the services rendered to the community by Rotary Club of Colombo, together with National Cancer Prevention Program in preventing breast cancer. We are now ready to connect with Ms. Danya, who will share with us her experience of a successful recovery. Over to you, Ms. Danya.
I'm Danya Udukumbura. I was diagnosed with cancer 7 years ago. It was detected quite by chance because it was completely unexpected, and I was very young at that time. And the news obviously came as quite a bit of shock, but I think I faced it all right. But I asked the doctors, the first thing was, am I going to die? But they said absolutely not. It's completely treatable and curable. And they even joked and said, give yourself a couple of months and you will forget that this even happened. So from that point onwards, that is exactly what I focused on getting better. I let the doctors do what they do, and I focused on my physical and mental health throughout the recovery period. I had to go through all stages of treatment, unfortunately, because of the aggressive nature of the cancer. So I had to go through a surgery first, and then chemotherapy, radiotherapy, and finally the Herceptin treatment. But throughout the treatment period, I was very attentive, especially to my diet, taking lots of liquids, and also having a balanced diet with lots of proteins, because I was given 2 weeks between the chemotherapy period. Especially, I had to recover my strength and immunity, and I wanted to make sure that I never missed a single treatment session. Also, I had to do a little bit of exercises to recover from my surgery, and most importantly, I went back into a bit of meditation, because I personally felt that in order to recover physically, I needed to cleanse myself emotionally with some issues as well. But I think that really did help me through my entire recovery period. Of course, the love and support I got from my family and friends was immense. Without them, I wouldn't have got through this on my own. Also, it was very important that I kept myself really busy. I'm an architect by profession, and I didn't want this situation affect my work. So even during the most intensive treatment periods like chemotherapy, I made sure that I still did my site visits. Like I said, I've got 2 weeks, so on a day that I felt good, I would put on a scarf and travel to Kandy and other outstation sites and inspect my construction sites the whole day, come back, have some rest, and got myself prepared for the next treatment session. So I think that also really helped me to keep my mind off serious matters. When it came to hair fall, I didn't want to concern myself too much with it, because hair is something obviously which grows back. So until it did, I tried some fancy scarves, and when the hair was growing, I tried some daring haircuts and tried to make the best of the situation. And when I look back to what I've been through, what I've overcome, and what I've become as a result, now I think I can think of it as somehow a blessing in disguise, because at such a young age. That life experience transformed me into the person that I am today, and I am very proud of that. Finally, I want to leave a message with you. Number one is that early detection saves lives, just like it did mine. Number two, if you are going through this, I want you to know that post-recovery life is perfectly normal and perfectly beautiful. So keep dreaming about your dreams, chasing your dreams, and you would achieve whatever you want to do. Finally, I want you to be courageous, but most importantly, I want you to be happy. Worrying and being sad is not going to help you with this situation. So stay positive at all times, be happy, and stay strong.
Thank you, Ms. Danya, for sharing your experience with us, for being very positive and giving us positive outlook, giving hope to many other ladies in the community, which your experience sharing is very important for the community and which proves early detection really saves lives. Our final topic for today is current management of breast cancer. I would like to cordially invite Dr. Kanchana Vijayasinghe, Consultant General Surgeon, Colombo South Teaching Hospital, Senior Lecturer, Department of Surgery, Faculty of Medical Sciences, University of Sri Jayawardhanapura. He is also a visiting consultant of Lanka Hospitals PLC. To address the participants, I cordially invite Dr. Kanchana Vijayasinghe.
I think I really want to thank all the speakers for highlighting the importance of breast cancer. And what I really want you all to take home from all these lectures is today that breast cancer is the commonest cancer among females in Sri Lanka. And early detection is the way to beat breast cancer. I'd also like to thank Danya because I really enjoyed her inspirational talk. And with that, I think it's really nice for us to get into this topic about management of breast cancer. So this is where, let's say a patient is diagnosed with cancer, very unfortunate circumstance. And obviously, I'm sure Danya can relate to this. When the patient is diagnosed with breast cancer, the very next question they'll ask is, so doctor, what's next? So that is what we are going to discuss in brief right now. So to approach this topic, I thought I'll just quickly discuss what is actually meant by a cancer. So we all discuss about cancer. We know we have some association, we have some friends who had cancer. So what is actually meant by a cancer? Now we have normal cells in the body, right? That is continuously dividing and replicating to maintain a healthy body, right? Now the good example that I can give you is for you all to be listening to this session and for me to, give this speech. Cells have to be multiplied within our body. So imagine there are millions and millions of cells dividing per second. So if we take an example of a factory where they are producing millions of products daily, I'm sure you'll understand that one or two products are bound to be damaged. So what does the factory do? They will identify these damaged products and discard them. In a similar fashion, our body also has this way of identifying cells which are damaged during this process. And what the body will do is they will destroy or discard these abnormal cells. But what happens is sometimes there are cells that are so damaged, or let's say they are so mutant that the body loses the control in them. And these cells continue to grow. So the body absolutely loses the control of these cells, and these are abnormal cells, and they are continuing to divide. And these are the cells that we call cancer cells. So if it happens in the brain, we call it a brain cancer. If it happens in the breast, we call it a breast cancer. So what will these cancer cells do? If you can see these pictures, the one in the top right. So this lady has a cancer in the breast. So these cancer cells are continuing to divide and destroy the breast. And you can see that it has even destroyed the skin and it is coming out. A very advanced stage is shown in the bottom right. You can see, so these cells, these abnormal cancer cells are multiplying continuously and they have come out of the breast and now growing outside the breast. So this is one key problem with cancer cells. They are continuously multiplying. We have lost the control and they are destroying the tissue from where they have arisen from. So that's one problem. Now there's another problem. I think Prof. Alok also touched a bit on this. Another key problem with these cancer cells, they have the ability to get into our vessels and system in the body and go all over the body, right? So they will go all over the body and lodge either in the lungs or liver or bone. And the problem is, what happens is when they get lodged there, they are not going to just stay there dormant. These are cancer cells and they are going to grow in that area as well and destroy those structures. So that's the stage which we call advanced stage, or we say, the cancer has spread to the body. So now we have two key problems to deal with. So with this, I would like to approach into my topic, right? The management of breast cancer. So we have two problems in cancer to deal with. One is the local problem, cancer cells in the breast that we have to deal with. And the second problem is the cancer cells that have gotten into the body. And so we need to deal with that as well. So in local treatment, that is now we have to get rid of the cancer cells in the breast. There are two main treatment options. And the key important treatment is surgery. Now, the traditional thinking about breast surgery, I hope it's getting less and less, is that once a patient has a breast cancer, we need to remove the whole breast, and the patient will end up with a flat chest with a scar. Now, I just want you to imagine if a patient has a bowel cancer, what would happen? The patient will undergo a surgery in the tummy, inside the tummy. An area will be, let's say there's a cancer in the stomach. The patient will undergo a surgery, part of the stomach will be removed. But what will the patient see at the end of the day? The only thing that the patient will see is the scar in the tummy. But the difference with breast surgery is whatever the breast surgeon does, it is very apparent to the patient, right? Because it's an external surgery. So whatever the deformity that we do, it is obvious and open to the patient. Now imagine a patient waking up every day with a flat chest, taking a wash every day, or seeing herself in the mirror every day. And when they see this, it becomes very difficult for the patient to move past this and forget it and move past once the treatment is over. So that is why in today, modern day, we offer breast reforming or breast reconstruction surgery. So this is a young female in her early 20s who had a breast cancer in the left breast. Imagine if we just left her like this. We have removed the entire breast because of the cancer. But if you can appreciate, we can see a little bit of a swelling there. We have inserted an expander. We are gradually expanding that area to reconstruct the breast. So if you look at this picture, I'm sure you will doubt me if I say that this patient has undergone breast cancer surgery. And to prove, and just to convince you, I'm showing you this picture to show that there is, can you see this scar underneath the breast? So we have, this patient had an extensive cancer in the lower area, and we have done a surgery and we have reformed the breast. What I'm trying to show you through these pictures is that it is no longer a mutilating surgery, and breast reformation is possible. Again, this patient had an extensive cancer just above the nipple, so we had to remove an entire area of skin and tissue. But if you appreciate, you can see the breast shape and size has not changed apart from the scar. And one more last picture I just want to show you. So this patient had a cancer, and with that, she was suffering from macromastia, enlarged breast, and she was having severe back pain and shoulder group pain. So we took this opportunity to remove the cancer and reduce her breast size as well. So this kind of picture is something that we would not like to see. So in today's day and age, we do not want to see this kind of scars, and we have opportunity. We offer all our patients some form of breast reconstruction and reformation, and actually it really improves the quality of their life. I also want you to notice, now this, unfortunately, this patient has had her entire breast removed, and you see her arm is also swollen. And this is because along with the surgery that we do in the breast, we remove some of the lymph nodes in the axilla. So few years back, we used to do an extensive surgery that gave rise to this complication in almost all patients who had breast cancer. But now we don't do that. We take a tiny little amount of tissue from the armpit called a sentinel node, and we check that, and only in required patients, we do this extensive surgery and remove a lot of tissue. So we try our best to do a less radical procedure as much as possible. Right, so the take-home message I want you to have regarding breast surgery for breast cancer is that it is no longer a mutilating or deforming procedure, but we try our best to give the patient a better quality of life by reforming or reconstructing the breast. So now let's assume we've had a patient who has undergone breast surgery, and we have tried our best to remove all the cancer cells from the breast. But sometimes 1 or 2 cancer cells might remain in the breast, and we just don't want to leave them there, because we all know these cancer cells have the incredible ability to divide and grow. So that is when we get radiotherapy to help us. So radiotherapy is high dose X-ray beams that are given or directed to the breast to destroy any more cancer cells that are remaining in the breast. So the idea behind these two treatments is to eradicate or destroy all the cancer cells within the breast. So that's about the local treatment. Now, once we have treated the breast, we can't just rest there, because we all know some cancer cells might have seeped into our body and might be lodged here and there. So we need to destroy them, or they will come out. So that is what we mean by systemic treatment. So there are a variety of options here. We call chemotherapy, anti-hormone therapy, biological therapy. I'm not going into detail, but the idea behind the systemic therapy is to destroy any remaining cancer cells in the body and to prevent the cancer from coming back. So sometimes we give them in tablet forms, sometimes we give in injection forms, and that is the principle behind systemic therapy. So I hope you have an understanding now of the 2 broad arms that we use in treating breast cancer. But I believe there is one key, very integral part in management of one more integral part in managing patients with breast cancer. And I'm sure Danya will also agree with me when I say this, and that is the psychological component that they have to look into. Now, so imagine suddenly a patient is diagnosed with breast cancer. Within the next 2-3 weeks, they have to undergo surgery. And then the next thing they know is they are getting chemotherapy, they are losing their hair, their body is undergoing different changes. They have to adapt to this lifestyle for a short period of time. They probably might be having children, a family to tend to. So a lot of things that are happening in their lives. So it is very, very important for us to see how well these patients are coping with this situation. And I really agree with the statement made by a breast cancer survivor who says, when we talk about breast cancer, the human element is too often lost in the sea of statistics and studies. And I just couldn't agree more, because even as a medical profession, as doctors, we try to treat the patient as fast as possible, try to get the surgery done, get the treatment underway. But I think we need to also take a step back, discuss with the patient and the family how well they are doing, and what would they like to have, do they want some time, etc. Right, so I just want to mention a few things on this, that everyone copes with diagnosis of breast cancer in different ways. So there's no right way or wrong way or a correct order to have them in, and it is very, very difficult sometimes to move forward following breast cancer treatment. So we need to be very empathic. We do have some support groups here who are doing a fantastic service. We have helplines, counselors, breast cancer survivor groups, and these are very important during this period. Right. So I hope you understand something about management of breast cancer. It is a nice to know topic, but I think the key thing for you all to know is that it is the commonest cancer in females, and please go ahead with early detection, because that is what will save lives. thank you very much. And I would like to conclude by saying that someone has cancer, it's not only the patient, the whole family and everyone who loves them does too. So go ahead with early detection. Thank you very much. And I think we will have a small Q&A session.
Thank you, Dr. Archana Vijayasinghe, for the valuable insights given on the current management practices of breast cancer. I'm certain that all our participants obtained a wealth of knowledge from it and had a glimpse of the marvelous outcomes of surgical procedures done preserving the breast. We would like to move on to the question and answer session. We have received few questions from the audience. There is a question asking a lady who had early menopause at the age of 42 years, is there a risk to take hormonal replacement therapy?
Dumitra, thank you. Dumitra, thank you for the question. Dumitra, it is like this. Now, what we need to understand is hormone replacement therapy does increase the risk of developing breast cancer. So unless it is a real necessity, it is better to avoid taking hormone replacement therapy. So it is important when you're talking to your VOG, when you meet your gynecologist and when you discuss this, to see whether there are other different options available rather than taking hormone replacement therapy. For instance, now let's say if you're suffering from early menopause, see whether there are other medications and other options available other than hormone replacement therapy, and there are few products available. So first, maybe it's better for you to try them and see whether those medications are helpful before going ahead with hormone replacement therapy. And if you do feel you really require hormone replacement therapy, it's better to make it as short as possible, to take it for a short duration, maybe for about 6 months, and see, and stop and see whether it is, you can, the symptoms have subsided during that period. I hope I have answered, Dumitra. So you want to add?
Thank you, Dr. Kanchana. There's another query asking to get an examination done of their breasts, whether they need an appointment at the cancer center, especially these days.
I think probably Nirmali would be able to answer that. I actually honestly don't know about how to. I think Nirmali showed her in her presentation. She showed the way to get an appointment. She showed the contact numbers and times that the cancer centers are open.
Nirmali?
Is Nirmali around? Maybe if she can.
I'm here. Hi, am I on screen? Can you see me?
Yes, can see you.
Okay, hi. Yes, so you can just walk in and consult the doctor, but the doctor will essentially decide about the need for a mammogram. So that would be possibly on another day, but even that you can't go and just arbitrarily put in for an appointment for a mammogram. It doesn't happen like that. It will be based on the doctor's assessment. But the first step would be to go to the center and meet the doctor on duty there and have a consultation. And then thereafter they would decide whether it's necessary to have a mammogram. I believe that's the process. But if there's anyone from National Cancer Control Program, there was a Dr. Virakun. Doctor, perhaps you can enlarge on that, because it's really NCCP who do the operation.
Yeah, usually it's a walk-in clinic, but currently due to this COVID situation, we prefer to give an appointment over the phone, and then they will be given an appointment, and we can proceed. So our contact number is the clinic's contact number is not 113, not 113, not 113, 159 227. Not 113, 159 227. So that's the number you can contact through this number in weekdays and get an appointment and you can go, but in coming future, you'll be go back to the normal routine work, and anyone can come at weekdays and they can go ahead.
Thank you, Dr. Sadharma, for that input. Apart from the National Cancer Prevention Program, we also have screening services at Lanka Hospital's Well Women's Center. So we will be displaying our numbers, so you can make an appointment to come for a breast screening. There is another question asking regarding the frequency of pap smears. Pap smears are indicated over 30 years of age, and it should be done in once in every 3 years. The screening starts at 21 years of age, and it's indicated every 3 years and up to 65 years. That is the medical indications. There is another question which says about breast conservation surgery versus mastectomy. Dr. Kanchana, will you be able to give an input on that? Professor?
Can you repeat the question?
The patient wants to know the benefits between the pros and cons between breast conservation surgery and mastectomy.
Breast conservation surgery means you are not removing the entire breast and only part of it is removed. So the final appearance would be as if there was no surgery done. So it should really look like the other breast to take it. But it is suitable only for, some patients, but I would say most patients, because nowadays if you detect the cancer early or even if it's a little large, you can shrink it and remove that part of the breast and conserve the breast. But it has to be always followed up with radiotherapy to ensure that the cancer does not come up again in the same breast. And if you take the overall outcome, the survival, there is no difference whether you have the mastectomy or breast conservation. So if the doctor recommends, breast conservation is good. But you have to remember that it has to be always followed up with radiotherapy, which has to go on for about 5 weeks. That is 5 days a week for 5 consecutive weeks. So that has to be borne in mind in order to reduce the risk of the cancer coming back in the breast. But dying from breast cancer does not depend whether you have breast conservation or mastectomy. The survival benefit or the overall outcome is the same. And only a few will not be actually suitable for breast conservation, particularly if it's a multifocal cancer. That is, the cancer is not in only one place, but in multiple places. So those are the patients who are not suitable for breast conservation. So, but that the surgeon will decide.
I think even if you need a complete removal, there is the option for breast reconstruction. So you can always reform the breast.
Thank you, Dr. Kanchana, for that input as well. Now we will play a short video clip of the Well Women's Center at Lanka Hospital. Sound. දැන් ඔහම ගියද ඒක තමයි. I would like to take this opportunity to introduce the services provided by Women's Wellness Center at Lanka Hospital. It is an exclusive center dedicated for women of all age groups, from puberty to menopause. The center features country's best and renowned gynecologists and surgeons. The services include routine well-woman care, cancer screening services, gynecological services, pre- and postnatal care, and sexual health services. The center has ultra-modern equipment, including latest state-of-the-art Fiji digital mammogram, which ensures minimum discomfort and lowers radiation. We have now come to the end of the program today. First and foremost, I would like to thank the management of Lanka Hospitals PLC for giving us this opportunity to conduct this awareness program. Our heartfelt gratitude goes to our guest speaker, Professor Aloka Patirana, for dedicating his precious time to be with us today. Dr. Kanchana Vijayasinghe for taking time off her busy schedule to enlighten us on current management. We have now come to the end of our program today. First and foremost, I would like to thank the management of Lanka Hospital for giving us this opportunity to conduct this awareness program. Our heartfelt gratitude goes to our guest speaker, Professor Aloka Patirana, for dedicating his precious time to be with us today. Dr. Kanchana Vijayasinghe for taking time off her busy schedule to enlighten us on the current management practices. Dr. Sadharma Veerakoon for the excellent presentation done on the introduction. Ms. Danya for sharing her experience with us and inspiring all the ladies in the audience. I would like to thank Rotarian Arosha Nanayakara and all the members of Rotary Club of Colombo for being a part of this worthy cause. Rotarian Nirmali Samarathanga for sharing the inputs from the Rotary Club of Colombo in early detection and prevention of breast cancer. We would like to thank all the participants from Rotary Club of Maldives, Inner Wheel Club of Colombo, Navavidana, and Rotaract and Interact clubs. My heartfelt gratitude to the marketing team of Lanka Hospitals and staff of Women's Wellness Center. Last but not the least, I would like to thank all of you who joined us today to make this webinar a success. Thank you and have a pleasant day.